Hi guys, so today's podcast episode is with Dr. Saad Shafqat. He's from Pakistan and he's got loads and loads of things in common with me. I'm quite excited to talk definitely Manchester United. I think he's wearing the shirt there. Can we see that? Let's just
Yes,
check.
I am.
Yeah, there we go. But of course, Saad is also a dentist, so I'm sure we'll talk a little bit of dentistry as well. You were just telling me off the air that you've got accepted into a perio program, is that right? Or was it uh, with implants and stuff as well?
Yeah, so thank you, Dr. Jabir, for inviting me for the show. And since I said that off here, that I just got an offer letter for a master's degree at University of Malaya. Yeah, it involves perio and implants both. Yeah,
Perfect.
so I hope it'll be good. Looking forward to it.
Yeah, and where did you do your undergrad?
Currently, I'm residing in Karachi. So yeah, I did my undergrad from it's over here. It's called as BDS, and I did it from Ziauddin University.
Hmm.
And yeah, I graduated in 2017. Did my house job. It's like VT over in UK. That's like a 1 year job. So I completed from my alma mater as well in 2018. Then I got a job. Worked at a private setup for like a year, and then COVID happened.
Yeah, how did you find that VT? Did you find like you got a lot of experience, or did you go into it, already fairly competent and confident, or how did things change during that year?
It changed dramatically because once you go from this, like it's a here, and in final year you have those patients to do. You do that, but when you get into the house job program or the VT, so it's like you're this senior guy, like who has to guide other students as well, and when the going gets tough, and if someone's so you're like years. So you get to, experience that as well. Like when there's a difficult situation, you have to handle patients as well. You have to handle. It's like a totally different scenario, and then you get to interact with teachers as well in a different perspective because you've shifted from a student to a dental professional now.
Yeah.
So it's really this learning curve. It goes up, like the graph goes up, and for you it's so brilliant because 1 year back a student and you were just asking questions, but in house job or VT you become like the senior from whom the students ask questions. So it's like just a different scenario altogether. So yeah, it was brilliant. It was really fun. Learned a lot, made a lot of friends,
Yeah.
and increased my PR, and which has helped me a lot, alhamdulillah.
Yeah, perfect. And then this perio and implantology that you are getting into, what was the application process like that for that, and how competitive is it? How do you think? What do you expect to learn? Is the main thing I'm trying to work out.
All right. So the thing is about the application, what happened was that there was this teacher of mine in Perio. We have periodontology in our third year.
Yeah.
So I got inspiration from him. Like he used to guide me a lot. He taught me how to do the ultrasonic scalings and the manual scalings and some sort of gingival surgeries, and then he got me involved in research. So he was like the main guy behind it. So I'm taking the opportunity through your podcast, and I just thank him a lot. Like he just made that pathway for me to follow.
Yeah. What
So
research? What
interestingly,
research were you interested in, or did you get you to do?
a number of them actually. I've got like 6, 7 research papers. So they mostly involve lasers
Okay.
and lasers and perio and implants. So I got to the manuscript part of it because he used to give me the data and I used to do the manuscripts. So hopefully, as you said that the learning which I'll be doing in hopefully in Malaysia. So I want to learn the process,
Mm.
like the clinical process, like when you do something and then you go through a clinical trial, like the medicinal application, the adjunctive therapy, all those stuff. So I want to experience that. and then the statistical analysis and all those stupid SPSS and other softwares. So yeah, and then those tests, the T test, Man Whitney test. I don't know, a lot of tests. So yeah, once you learn them, once you perfect them, then you can perform your research on your own
Mm.
because it's so intricate, it's so brilliantly organized. Like people are like, you can say, sharks. These researchers are like sharks. Like if they see that this, if I give you an example, for example, there's gingivitis,
Yeah.
right? And you're using scaling and root planing on one side as one intervention therapy,
And
and
laser on the
lasers
other
on
side,
one
yeah.
side, and laser on the other side. All right. So your control group is with your SRP, and the test group is your lasers. So all the patients have gingivitis, right? So if, and then your variables which you're measuring are pocket depth, bleeding on probing, and some some variable. If you miss that variable in your research, the guy who's the shark, he would pick up that variable and use the same topic outline and use that variable in his research and find that variable out. So yeah, it's this intricate, and this, it's just amazing because the brains these researchers have is like top notch.
Yeah.
Like you can't, like they think in a different level because from biomaterials to dental materials to these surgical techniques, these implants material, implant size, implant depth, it's just amazing because this world of research is just. But yeah, again, if you're not interested in research,
It's gonna be a
I would never
it's gonna be a
recommend you
struggle
go.
for those guys,
Yeah.
yeah.
Oh yeah, it's going to be a struggle because it's not easy. People say as if, just get in research and all that. It's not that easy. You've got to have the mind for that research because it's brilliantly intricate, but yeah, it's hard. But again, you need a good mentor. The main thing is the mentor.
Yeah, it's interesting because I'm one of those people that most of the time I'm going straight to the abstract and then I'm going scroll, 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 conclusion. And then if I see something maybe interesting there, maybe very, very, very rarely I'll start reading the rest of the paper. But every now and then something
Yeah,
interesting comes up. And just the other day, I was reading about. I was on Twitter. I don't know what I was doing, and then I was just clicking on random profiles, and then just reading tweets, and then clicking another tweet, and then this thing came up. It was UCL, periodontology. So there's some professor. They brought in 70 odd athletes, and they got baseline readings, and then they worked out their current athletic output scores, their performance variables. Then they gave them strong OHI, and then followed up over certain periods of time, and they were able to improve just by improving the OH. They were able to improve the output on the field. These guys were rowers or
wow.
cyclists or something. So I actually I tweeted that professor or one of the people involved, and hopefully you're going to be having him on the podcast soon. I sent the email today. So it's every now and then you do find something really interesting, but it's for me it's not very often. It's usually endo or something sports related, which I can either implement in the gym, or it sounds like, oh, that sounds interesting. I want to know more.
Yeah, yeah. Actually, it's quite it's this field which is upgrading the sports dentistry.
Yeah.
I had I wouldn't say the opportunity, but I went through a profile of this guy. I think he's based in the U.S. and he had something in sports dentistry. So it's an emerging field. It's like an incognito field right now because it mostly involves aesthetics and all that stuff. But yeah, it's quite interesting because perio itself is the, you can say, the foundation because again periodontium involves
Mm.
everything. So periodontium for me is like the foundation for dentistry. So one of the main reasons why I chose perio is, one thing, over here in Pakistan it's not up to this you
Yeah, I've
see in
heard people
UK,
say
US.
this. Yeah, perio is maybe not
Yeah,
well taught, or there's not enough periodontists,
yeah,
not enough good
yeah,
implantologists, and if it's the basis on which we're doing everything. I've seen, unfortunately, patients who've gone to Pakistan for a holiday or weddings, and people have just slung in bridges and all sorts of crazy, crazy things, and they come here and we go, "That's gonna have to come out, bro. Sorry." And then it's usually catastrophic failure when something fails, and it's
The
because
thing, the
yeah,
yeah, yeah, the thing behind that is the cost. Number one reason is the cost.
yeah, yeah.
Because comparatively, the thing which happens over there in the UK and the US is that they charge for their skill,
We really
and the
charge for our
skill
skills.
over
Certainly private.
yeah.
NHS, let's not talk about that. I don't want to be
Yeah,
sad tonight
NHS
on
is
Friday
like
night.
totally different level. Yeah, NHS is like, just separate it, like, just put it aside. Yeah, privately, yeah, the charges over there, and if I give you an example, people say that we get our return tickets, our airfare sorted, and our dental treatment sorted in the same amount of in the same amount as if you're giving it in the
Yeah.
UK. We can get our return ticket in that amount. We can get our dental treatment done over here in Pakistan. It's not like Pakistanis. Yeah, the skill over here is pretty good as well, but it's not the
Regulation.
level which the
There's
UK
no
has.
less regulation,
Yeah.
so people, and this is the trouble, right? Because I spoke to Dr. Mack. I don't know if you saw that particular podcast. She's the Turkish lady, and she said, "Look, there's
Hmm.
incredible dentists in Turkey, but when people go to Turkey,
Yeah.
they don't go to the good dentist. They go to the crap guy, the guy who's just he doesn't care because he knows you're not going to bother to come back on another flight if something goes wrong." And this is the problem, and obviously then you're gonna come back to where you live to try and get things fixed when you realize somebody's messed up. So it's
Yeah. Yeah.
but there's
But
good
yeah. But then
Pakistani
again,
dentists as well.
yeah. Yeah, there are pretty good dentists, and I've had the privilege of working with a few of them, like the best dentist over here, and I reside in
Mm,
Karachi. So I've asked to work with a few of them with a good, like a good pedigree and a good resume. So yeah, they're pretty good. They do stuff like crazy stuff. I had the opportunity to work with an oral and maxillofacial surgeon for a year. He used to do trauma surgeries in front of me, and he used to do those extractions, the third molar extractions, like literally like this. If you can see my hand, he just used to do like this, and
pops. Yeah.
yeah, the tooth just pops out as if he's talking to the tooth. Like, all right, I'm giving you pressure. You just come out like a normal guy, and yeah, it just used to come out.
Mm,
And I used to go like, wow. Like then he used to say that this is around 25, 30 years of experience.
mm.
I say, sir, I'm not even that age. The amount of experience which you have. So yeah, he said that yeah, it'll take time, but yeah, you'll get there somehow, somewhere,
Yeah,
inshallah.
that's the thing. All of these things take you a long time to skill up to that level. And then, if you're not trying hard and you start cutting corners, then you're going to be giving the funny denture, and you're going to be giving the funny half a scaling, half a scaling group planing, and the incorrect way.
Eh, Yeah, the thing over here is that I don't know if it's there in UK or not, but the level of mentorship and the level of guidance, it's if I don't know in UK if it's there or not. But
Mixed,
there's
mixed.
just some sort of a gap.
Mm.
There's some sort of a gap over there. Like there's a huge gap. Like if there's a student is on this level and the guy who's on this level, a demonstrator or a professor or whatever, he wouldn't want this guy to
Or get to the
come to
same
this
level.
level.
Right, okay, got you.
Yeah, yeah,
It's a very
yeah.
strange
So
thought.
there's yeah, it's
Mm.
it's a strange thought, but yeah, it's just it's we're trying to get rid of this thing over here. But yeah, I'm just talking, unscripted and like that because this is a podcast. But yeah, I'm talking the truth over here.
Mm.
So yeah, that's this thing that we want to change. If I practice over here in the future. So
It's the same here.
what I
It's the
do with
same
my
everywhere. I'm going to tell you that for nothing. There's guys out there
mhm.
in Pakistan who want everybody to succeed, and there's guys here in UK, US who want everybody to succeed. I know we spoke about Brett Gilbert when we were on off air. He's one of the guys. He just wants everybody to be as good as he is. And the way he
Yeah,
explained it to me, because he's a good friend of mine now, I met him in person and done a few live shows with him and stuff. He goes, look, I can see maybe 6 cases, 7 cases, 8 cases a day. I don't want to work. He doesn't want to work more than maybe 3, 4, 5 days a week. There's 100, 200, 300 million people in the States. He's not going to see all of them. What's it matter if someone else is good as well? What does it matter? Like,
Yeah, exactly. Because you just make opportunities for us young guys or
mm,
girls. Because we see you as if you're like the teachers from a different level. Like we come to you for your
don't come
guidance,
to me.
and
I'm 1.5 years out of university. I just talk a lot.
so yeah. But yeah, I've seen your sessions. Yeah, like you delivered this one session at University of Manchester. So yeah, that's quite some. That's something, man.
On
University of
social
Manchester is
media, not on dentistry.
like. Regardless, man, they called you over there,
Yeah,
and you talked about social media, because social media is one thing which is booming right now.
yeah,
Because if you want to market yourself, social media is something which you can use a lot. So it's an Instagram world, it's a hashtag world, so might as well use it.
yeah.
So
Sure.
you talked about the application process over there. I missed that
Yeah, yeah.
question.
Go for it.
So yeah, during my application, what happened was the first thing which is important is looking for a supervisor,
Yeah,
because the supervisor will make you, get on that line, on that road to your program. So fortunately, I contacted a few professors, but two of them, they kind of said that we don't have the space or something. So I was like, okay, fine. Then I contacted another one who had the same specialty which I was looking for. So thankfully, she replied, and we had a call session, and she looked at my resume, and then she was quite, happy. And
yeah.
then she had this, this topic in mind. She presented it to me. She went like, we're trying to do this in perio implants and all that. So I was like, a bulb just clicked open in my head, like, okay, perio implants, like that's, oh, that's my field, like I want to go inside this.
Mm,
So then it went like, all right, fine. Then she discussed, so we came to a conclusion that, okay, fine. So then she said, okay, now, it was like a very casual conversation, but yeah, you have to break the ice with the supervisors, because again, they're on a different level, and it's just pure luck if you get a good supervisor, or your basically your resume and your research proposal, that makes a huge importance in your selection,
yeah,
because I had the opportunity to make a normal research proposal, which I, emailed this proposal to her, and she just helped me out. It was just it was just because I'm just a normal, a BDS graduate. And I had never designed a research proposal before,
yeah,
so I just made something, went there on YouTube, asked some other professor, asked some other teacher of mine, like, help me out and this and that. So they helped me out, and but then again, she's a supervisor, so I emailed it to her. She said that these things are, they're not on the same level which I want. So I want just, just change these things a bit. So I changed that. I sent it to her, and she sent it back to me. Or I changed this, and I did that and that, and finally it got. She said, okay, this is fine. Now apply for the university.
yeah. So you
So
wouldn't have been able
once
to do it without this help.
the research, yeah, exactly,
Mm,
because the help is needed. I always say this to my younger generation. I always say this, that no question is stupid. Ask questions, as many questions as you want from me or the other professors, and they just go like, it's a hard world. In fact, before, I had a phone call with a junior of mine.
yeah,
I think around like 7 8 p.m. over here in Pakistan. She was all, backward, like, this COVID happened and things are not getting. I don't know what will happen and all that. So yeah, she had that sort of a depression on her. So when,
yeah,
like, it's happened with everyone, like from the professor level to the student level. It's with everyone. You just have to have a good mindset. The mentality should be there. You just have to have positive thoughts. That's it. So yeah, she went like, yeah, thank you for the pep talk and all that stuff.
yeah. The
I
the
was like, yeah,
problem
it's
is
needed.
there's no, if I can tell you, okay, well, or somebody can tell you, look, in 6 months, I promise you, and 100%, this is 100% accuracy, COVID is gone. Then you've got, okay, I can sit in the house for 6 months, so that's fine because I know when I'm coming out of the house. But that's not how it goes. This COVID, it's second wave, third wave, fourth wave, who knows? And that's the problem, and that's why everyone's thinking, well, I don't know what the future holds, what's going to happen, is everything messed up? Can I, if I'm in university, dental student, we can't go inside, so we can't do any treatment. So we're going to have a degree, but we're going to have no technical skills. And this is the problem. And I don't see how you can really resolve that. I think you just got to be strong for somehow. Um, but that's how I feel about it. Like, you can't, if there was an end point, people are going to feel much, much better about it and they're going to stick to the rules easier because they know. But because there's no real, okay, that's when everything will be fine. Like, I don't know, if you're doing a takeoff, you have to put the seatbelt on until you're at the top, in the air. It's not like this. We're still going up, man. The pilot's still. No, we'll go a bit more. We'll go a bit more.
Yeah.
He's.
It's as if the pilot is hovering.
Yeah.
It's like it's just there, like it goes up a bit and then it goes down, then it goes up, then it goes down. Yeah, it's like it's a really good example actually, because yeah, I don't know, it's like we have to live with this
Mm,
now. I believe you have to have that positive mindset. You think about the positive things, like people used to go out, they didn't have time for their families, they didn't have time for having a chat with the family, or watching a movie with the family.
yeah.
I finished. My dad, he finished this Turkish season, like Ertugrul. I don't know if you've watched
Finished
it or
it.
not. He finished. Yeah, he finished that season in a month. In a month,
Oh,
or
that's not healthy. That's
1.5
not
months.
healthy. That's there's 80 episodes in each season, and there's like five
Exactly.
seasons.
He
It took me a year and a half.
he watched he watched it as if a teenage guy. He binge watched it, and we watched him with him, and the whole family was there, so it was like a whole family meetup sort of a thing, like dinner serving over there. He used to tune it on
Uh,
in the morning, then he used to since no work was happening, so he went like, yeah, just watch this. So in one day he used to finish like 7 8 episodes, and we were like, Dad, what's wrong with you? But yeah, he had fun. So yeah, it was a pretty good series. I really liked it.
yeah, I think it's like the most watched TV show of all time or something now, right? Let me
Yeah,
Google that actually because I'm 99% sure it is.
it's been translated into a lot of languages as well. Because Gordon Ramsay is like a sensation, man. He's just the guy
Yeah.
in he's the master chef. I watched a lot of master chef, like master chef US, UK, Australia. Personal favorite, master chef Australia. And when Gordon Ramsay comes, you know that something big will happen. So the last season was pretty good.
Mm.
MasterChef Australia, they brought all those, the alumni, and it was pretty good. I really liked it.
I've not watched much MasterChef recently. We used back in the day, like 5, 10 years ago. I think I used to watch a little bit when I was still in school, because we used to watch when it
Hmm.
came home. But I've not watched any of the recent seasons. If I ever have time, I'll check it out. At the moment, I'm trying to cut down and trying to stick to uh, football, F1, and that's it. um,
Yeah, I used to watch F1 a lot. But again, over here in Pakistan, the broadcasting, it got a bit, down,
right.
because Star Sports, ESPN, they went off air, and then there aren't many channels which show it, because then you have to use the web to watch it.
Okay.
But yeah, I used to watch it in those times when Barrichello and Schumacher was there, Mika Hakkinen was there, David Coulthard, and Ralf Schumacher, and Vettel was coming up. He was in Red Bull, and then Mark Webber was his partner, and Lewis Hamilton was coming up as well. Fernando Alonso in Renault. Then he joined
Mm,
Ferrari. So yeah, I know what's going on. Like it comes on my
just not
feed.
watched it.
Yeah, because at that time there was Steve Slater over there, and the commentary was pretty good. and it's not the same. The broadcasting has gone down, so that's why I don't watch it anymore. But
Yeah,
yeah, I know what's happening.
yeah.
I
No,
keep myself updated.
I like to watch that because I don't know. I like the mathematical side behind it. You know, you can see that certain guys, you know, they've made some adjustments to the car, and you know the strategy. Okay, we're gonna block this guy off, so then the pack goes a bit slower. Then we can pit now and then get in front of this guy, and all while
Yeah,
doing your 200 miles an hour. They're making all these
yeah,
decisions.
The DRS system, and then which tires to use, the flat ones or the soft ones, or
Mm.
yeah, it's pretty good. I remember this one race in I think it was it was at Monaco. Monaco is like a street circuit, so it's just so amazing, that circuit. I don't know if it's on the, like, the plan nowadays or
No,
not, the
it should
Monaco
be
circuit.
this year. It should be in. I think Monaco's like the classic race, even though there's never any overtaking and stuff. They always have it.
Yeah, yeah, because the streets are so narrow.
Mm.
I've seen Lewis Hamilton do some overtakings over there as well. So Lewis Hamilton is like something else. Like, my favorite of all time is Michael Schumacher. My brother, my elder brother, he was a McLaren fan.
Mm.
So he loved Mika Hakkinen, like crazy, crazy, crazy fan. Then Lewis Hamilton came in. Then he went like, all right, Lewis Hamilton is, he's doing something really good. But yeah, my all-time favorite, Michael Schumacher, hands down. Then Kimi joined in, Raikkonen, and Fernando Alonso came in. So yeah, it was something like, things were going good. But then Vettel joined in.
Yeah,
But so
I think Lewis
his
is the
breakout season
best.
was that. Yeah, Lewis the best.
I think
He's just
well, I think
crazy.
now I think we're gonna see in the next couple of years that he's best of all time because I don't think anyone gets anywhere near him. Current races, he's not even trying. Like you know,
Yeah,
it doesn't look like he's even trying half the time. And then you know, one time you got the he had the drive through, and then just out of nowhere he gets from the back of the grid to fifth with, and it's like he's not done anything. He's you know, it was crazy, and he's
yeah.
still you know just killing it. So I think
Because
he's
nowadays, like people like Vitali Bottas, they're coming in the podium,
mm,
and I go like, dude, this guy used to come around like 11, 12,
yeah
or 13
better car.
when
Yeah.
yeah, better car actually, yeah. But again, the level of driving at that point when I used to watch it, it was just amazing, like insane stuff.
Yeah.
And although the technology supports them right now, I just imagine if Michael Schumacher had the DRS system on his car, he would have just blasted through every circuit.
Yeah,
And
it'd be interesting. Well, we're never gonna see it, but I don't know. I think they had less to think about, you know, before.
yeah,
So would he be able to adjust to having all these things to control when he's not come like through like that, or would he be someone who is better off when he just has to stick his foot to the bottom of the, you know, foot to the floor and just go around? Interesting because it's completely two different driving styles. They have to do with so much tire management now, so much engine
yeah,
management. I That's the one things that I wish would be kind of got rid of is engine management. There's no point to having motorsport when you're scared your engine's gonna blow up if you go too fast, or you're gonna get a penalty if you use too many engines in the season. We want to see people going
yeah.
fast the whole race. You know, I don't care about
And and
this
the
other stuff.
and the aerodynamics have also changed,
Yeah, yeah,
because it's more of a sleeker design now. And it used to be like big cars. Like, if you take the width of them,
yeah.
they used to be bigger cars, but now they're quite,
Longer,
slender.
yeah.
It's more of yeah, longer and slender. So the aerodynamics has changed dramatically. And I remember when Rosberg won the F1 title with the Mercedes, and he was pretty good, but then he retired.
It killed him
I
to
was
do it.
like,
It literally killed him to win that title.
yeah, it was like, why? But then I got, as you said, that it killed him. So I was like, all right, finished on a high, retired on a
Mm.
high. So yeah, Nico Rosberg is remembered. Although when he was in, I don't remember, I think he was probably in Williams, if I'm not
He
wrong.
started at Williams. Yeah.
So yeah, he was there. So he wasn't at the same level. But as you said, the car does wonders. So, and yeah, that was a pretty good season.
Yeah.
Nico Rosberg did very well for McLaren
Yeah,
Mercedes.
and that's the thing, it took so much out of him he had to retire as opposed to going up against Lewis again because it was only a couple
Yeah,
of points between them and it came down to the last race and Lewis was backing him into the pack, trying to force other people to overtake him. It was
yeah,
a very, very dirty race he played, but that's the thing, like he was confident, I'm still gonna win this race. I'm good enough that I'm gonna drive only 1/10 in front of you. You can't overtake me, and I'm going to try and push you back. That's something crazy. Because most people, you
yeah,
get in front and you're going, okay, I'm just going to go now because I don't want anyone to catch me. But he thinks, okay, I'm
yeah,
good enough that you can't overtake me, and I'm still going to try and make you lose the title by forcing other people in front.
yeah.
Dirty races, crazy,
The sur-
crazy.
yeah, the surprising part was when the Red Bull won, like Vettel won with Red
Yeah.
Bull, and the constructor championship. I think it probably went to Red Bull or McLaren. So the funny part was that how did he do it? And then when he came to Ferrari, so he had a better car.
Oh, much, much
And
better.
during the earlier seasons, he used to be pretty good. But now, if you see Vettel now, I think he's probably leaving Ferrari, if I'm not
Yeah,
wrong,
and
in this season.
I suspect they're messing around with his car.
Yeah, I don't know, because he used to be so good, or maybe I'm not watching it at the same level like I used
Mm.
to. And I remember it was probably Belgium or the Italian Grand Prix when Vettel won in a thunderstorm
Yeah,
that race.
he's very good in the wet. I just get the feeling that
Yeah,
Ferrari don't like him and they're probably disadvantaging him with parts and because he's not staying because their car is so bad, but he's
yeah,
not as bad as this car is showing him. No way. And he's not someone that I've always liked, but there's no way he's as bad as this car is showing. Uh, I think they're
yeah.
definitely messing about with settings in his car or parts and stuff like that. Just it's kind of the Ferrari thing to do. They're a bit snide.
I don't know what's happening
Yeah, it just seems very
in
messy.
Ferrari. I don't know what's happening at Ferrari
Yeah,
because McLaren's going boom and then Ferrari is going a bit down.
yeah, they're not doing too
And
well.
Red Bull is like just hanging around on a boat. Like when Vettel and Weber were there for them, they had a good standing in the constructor championship. But now I don't know what's happening.
Yeah, it'd be interesting to see. I heard that
Yeah,
you've got a football show as well, right? What's all this about?
yeah. Yeah, so we started back in football when Football World Cup 2018 came on,
Mm.
and there a group of friends. One's a Chelsea fan, I'm a United fan, and then there's a Barca fan, and uh, and we have a couple of other fans as well, like two Chelsea fans, three or United fans. But the main team comprised of four,
Yeah,
and then there's our host. So we just went like it's like basically a show where we talk about football on a very casual level, as if I'm talking to you right now.
yeah.
And our host calls it as if like four people are sitting on a coffee table and discussing
So the
football.
exact same
So
thing that we're
whenever
doing
I
here.
yeah,
It's the
exact same
same
thing,
idea.
exact same
Yeah.
thing. And yeah, same idea. But it involves more people. So our host, does he's played cricket as well at the national level. Then the Chelsea fan who I'm talking about, he was a national table tennis player for Pakistan as
Oh,
well.
nice.
And then there's me, who's a dentist slash football fanatic, crazy fan of United. And then this other guy, he's a Barca fan, a crazy crazy Barca fan. Like I haven't seen a crazier Barca fan in my life than him. He knows about the academy. He knows about the younger guys. He knows about everything from the presidential level to the La Masia's, I don't know,
Mm.
La Masia's electrical wire as well. so he's so much into Barca. So the plan behind that was, just to raise awareness of football in Pakistan. And there are a lot of fans over here in Pakistan, like crazy fans. Like I don't know what's happening over here. Like we don't get the recognition. Only our footballs go to World Cups, and
Yeah.
our team does not go to the World Cup. So
Why
our only representation of football is through football
why do you think that
World
is
Cups
that
and
you
World
guys don't end up in any of the competitions? Because Clearly, there's talented sportsmen in Pakistan. You can see with the cricket team, number one rated in ODIs, right? But
The T20s.
T20s. I'm not that much into cricket. My brother's much more into cricket than I am. But
Yeah.
and yeah, I mean, you clearly there's some sports talent there.
Yeah, yeah. A lot of talent is here. We talk about this, like we can go for hours and hours on this. I think the main problem is we don't have the sports institutions. The the you can say the infrastructure is not there. Like in UK, you know that you have these small fields, then you have a training center, then you have this whole academy, then you have this whole club. Everything is there, like it's set.
Right.
People have invested, people have done everything. It's a huge mega infrastructure over there. The basic problem over here in Pakistan is that the infrastructure is not there, and the federation, it needs to work more than it is doing right now. We need more funds. We have the funds, we get the funds, but I don't know where they go.
Right.
And we can rant about this for hours. Like if you somehow come to my show someday,
So
inshallah, we
basically,
can rant about this.
I
We can rant about this for hours.
this is the thing. I have my well, I don't. I've only started using it again this week, but my for this season, I had my Manchester United YouTube channel, and because I have the season tickets, I was going to the games, and then the day after the game, I would watch the game again, and then I would
Yeah,
react to the
yeah, yeah,
game.
yeah. I follow you on Instagram, and
Yeah.
I get jealous when you're sitting on this at the Stratford end, and you're watching the game. It's like a dream of mine.
Yeah,
Like
you'll have to come because it shouldn't be too difficult to get tickets when you come back. I think people are going to be scared to go,
yeah,
and once it's safe-ish, you can definitely get. If one guy can definitely get a ticket for sure. But I had the YouTube channel as well, and
yeah,
I sound from what the sounds of it, that Barca fan of your friend, that's me but
yeah.
United. I know everything, everything that's going on, um,
All right, perfect. We can get you on the show.
and I'm very very opinionated, unfortunately.
Yeah, that's fine. That's fine. We need someone opinionated, because again, you'll be like a super guest for us, and we'll have the upper level on those other fans, because then two United fans on the show.
Yeah, and I think it's different because have you been to watch any game in person before? Even a local game,
Uh,
something like that.
yeah, 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 yeah. Ronaldinho, Sir Ryan Giggs, David James, what was his name? Yeah, Robert Pires, Lucas Bournemorte. They all came to Pakistan
All right,
for
and they
this
did some
leisure.
exhibition match.
Yeah, yeah, for this leisure league
Okay,
thing. It came here, and I also played that league. Our team came second, and but unfortunately we couldn't get to the top. We couldn't win our league, but yeah,
right.
we got, I think, we got two runners up in 2 seasons, but yeah, then the league stopped, so we couldn't play again. So, but yeah, one of our players, he played with Ronaldinho
Oh, nice.
and Lucas Bournemorte. Yeah, he exchanged with Bournemorte. He still has them, the pro boots with them. He's a friend of mine.
Yeah,
So I think he got them framed or something. So I don't know exactly what they, but yeah, I watched them.
yeah.
Experience. We shouted our lungs out for them.
I'll look on the social media and be like, everyone's slating Jesse Lingard, for example. And I watched him and I was like, well, he was everywhere, but just nothing came off. And there's
Yeah,
a
yeah,
disconnect because I'm seeing, oh my god, he made 10 runs, and nobody made a pass into him. And you guys are saying, oh, he got the ball once and gave it away. But you don't. It's because you can see in a different way, and it's interesting. And then you go on social media. There's the match guy going fan guys who are like loving certain players, and everyone else is hating them, and there's such a divide and all sorts of things. But it's purely down to that difference of the experience of watching the game and how they watched it, and
yeah.
yeah,
Exactly. Because yeah, you're absolutely right. Because the positioning and all that stuff. I was fortunate enough to get a coaching course over there in
Mm.
Karachi, with a reputed academy over here. It's called as Karachi United. So we were taught by two UEFA licensed coaches. One had a C license and one had a B license. So they taught us the basics of
Yeah.
coaching and the basics of technical and tactical analysis and all that stuff. So after taking that course, football became a different sport for me, like a totally different sport.
Yeah.
Like you analyze things on a different level, because they also gave us an assignment to do. Like they gave us to watch again Juventus and Atletico Madrid, the UEFA Champions League match.
Yeah.
Was so it was so intricate and so technically and tactically organized by Simeone, and I think Allegri was there at that time at Juventus. I'm not sure,
Yeah.
or maybe Sarri
They
was
change every
there.
10 minutes.
So yeah, it went like, like Ronaldo's running, Jimenez is with him, Jimenez is marking him, Jimenez, he simple movement where you go like one on one passing, then the guy, if one end is getting cramped up, the other guy shifts it to the other wing, the space opens up, and from taking further spot opens up the whole space of the game, and analyze that before, and the positioning,
Mm.
the drop of the shoulder to get the space. It's just a whole different level of football. Like, we don't analyze these things. We go like, all right, Jesse Lingard is not in space. He got that first touch, and bam, he couldn't do anything. Like
Yeah.
Lukaku is being, he's been rattled for his first touch like forever, but he
Which is
got
not
the
good,
most
to be
amount of
fair.
goals.
I kind of agree with the Lukaku thing because his first touch at United was terrible. It's improved in Italy for some reason. I don't know if the game is a bit slower,
Yeah,
but it suits him much better in that system than it did at United. But yeah, it's that thing. Like I get really wound, not very wound up, but a little bit wound up when I'm going on and people are like, what do they say? They talk like, oh yeah, just get another this and that, and like FIFA fans, the guys who play FIFA
yeah,
or they play Football Manager, and I hate those games because it's completely different. I can't play FIFA to save my life because it doesn't make any sense to me. Because I did a little bit of coaching and I did a lot of reading on coaching when I was younger, because I'm obsessed. And then you see it differently. You see the space between the lines, and people are compressing the area so you can't go, and they're forcing them out wide, and all things like this. And the average guy who's just watching it because they like football doesn't see it, and they just have the very surface level of the end outcome, not how it's got there and how something happened. Which is why I call my channel
yeah.
Diagnosing United because it's trying to go beneath the level, and also dentists. So yeah, diagnosing. Um,
Yeah. But yeah, it's fun. It's fun. Like, after that course, the football dynamics have changed like anything for me. From the defensive tactics to the offside line. How do you manage that? And if one person is going forward, the other person has to cover him. Like, if a right back is forward in the winger's position, the winger has to come back
mm,
into the right back position. That's like basic 101 defending.
yeah.
But people don't know that when you're playing the game, and you tell, like, if the right back is going forward, the right winger is supposed to cover that
Oh, it
position.
doesn't have
And
to be the right back.
when you go and say,
It doesn't have to be the right back. So the games that we played, we had a number six, someone who drops in. So you drop into the middle,
okay,
and then
yeah,
your centre halves will split and cover the space. You got the three, and then you got the two in front, and the fullbacks can go on.
yeah, yeah, what,
Somebody has to cover that
yeah,
space.
you're right.
Different ways of doing it.
Somebody has to cover that
Yeah.
place. Yeah, it can be your CDM, it can be your DM, it can be your center back, anybody, but there has to be someone there.
Mm.
But yeah, over here, yeah, he just went forward. That's his position. People don't come back. But when you say to them this stuff, oh yeah, you're like, oh, I don't know, as if you think you think of yourself as your Sir Alex Ferguson or your Pep
It's simple
Guardiola
stuff.
or your Jurgen Klopp. It's simple, basic 101 defending, man.
For sporting achievement or sporting technical level of performance output, I think, you can just boil it down to inflammation. You're not brushing your teeth. You've caused inflammation because of plaque buildup and, all this anaerobic bacteria and blah, blah, blah with food stuck there. And now you've got a bit of gingivitis or perio. Well, you've now released all these inflammatory cytokines into the blood. And, once it's in the blood, it spreads everywhere else. And if you've got inflammatory cytokine in the blood and you're a footballer, for example, you're going to have increased muscle injury because you're inflamed. Your knees are going to hurt because you're
Yeah.
inflamed. So you get 1% less performance. And in top level sport, and this is something else people don't understand and it gets really annoyed about, top level sport, the bottom team and the top team, purely fitness, if the top team is unfit on the day, like we saw Palace game on the weekend, because Palace had 7 games of preseason, we had 1 game. Purely fitness is enough to basically have you turned over, even though each and every player is probably better United than Palace. Just fitness,
Yeah.
2-3 weeks of fitness work that one team has and doesn't have is enough to see a change in the result. But things like gingivitis and periodontitis, that can now have an effect. So that's what's been established. Same thing. You're not brushing your teeth. You're going to lose 1%. That's your Champions League final gone. That's
Yeah,
enough.
I like the analogy of that.
But that's actually the link they described
So
within that study.
yeah, all right.
Yeah.
You've got to send me this research, man.
Yeah,
You've got
well,
to
I'm
send me
gonna have
this
the
link
guy on the
because
podcast. This is why it's gonna
yeah,
be. I'm looking forward to it. If he replies, I'm really hoping he does.
yeah. I would love to hear him talk on this because it would be brilliant. Because again, it's two things: dentistry and sports,
Yeah,
and primarily football. It'll be like an amazing podcast. Yeah,
yeah,
you talked about again perio. Perio is also linked with your eye disease. Perio is
yeah.
also linked with your liver disease. Perio is linked with everything because we had these journal clubs where we had to search for researches and then we had to present them like whatever we thought about that research, like
Yeah.
from conclusions to limitations to a discussion. And we've got to there's this class like 8 9 students and we've got to present it to them. So in that particular area, that journal club, I used to enjoy it a lot because I used to go through articles and again the abstract thing, the conclusion thing. If I used to find it interesting, I used to open up the whole article and I used to read them. But yeah, it's so I don't know what is the problem. I don't know. Like perio is something which should be the basic thing.
I think people
I can
find it
talk.
boring. I
Yeah,
think,
exactly.
yeah.
Because I don't know, but it's interesting to me because I don't know what's the source behind this because I don't know they're not the results are not easier to come by because when you do a gingival graft or a connective tissue graft you've got to wait for like a week
No,
or
I
14
think what
days.
it is, if you do root canal, for example, straight away
Yeah.
you can see I've done a good root canal, bad root canal. Nothing the patient does is going to affect how the root canal looks on your X-ray. Whereas
Hmm.
perio, just let's go simple, generalized perio. Unstable. I don't know whatever the new classification 2C or whatever it is. I don't know. He's got perio, right? And you tell him you have to do this brushing, you
Hmm.
have to do this you have to do this TP every day after every meal, and then you're flossing, and then you're brushing twice in the night, and then all these things. And that patient goes home and doesn't do any of it. You can do as many SRPs as you want. You're never going to have a result. Never in your life you're going to have that result. It's down to the patients who don't listen. The general dentist is just like, why am I bothering? Especially if the patient isn't paying a lot of money for that information and that treatment, they're not going to value it. They're just going to go off and do the same thing they always did because, I've been to the dentist now. The dentist will fix it. It's not my problem. It's his problem. I think that's why.
Yeah.
And then we
So
get sick of it and we're just like, I hate perio.
yeah. Yeah, the maintenance. Yeah, you talked about the maintenance. Yeah, it's very it's one of the utmost important things in perio, the maintenance part. I was just taking yesterday. I was taking a lecture, webinar from this guy. He's from Italy. He said the same thing. He said he presented a case where the probing depths were around 12,
Mm.
11, 10, like huge chronic of the highest order. But what he did was he said that, all right, I don't see any mobility over here. I don't see any, the patient is not in discomfort.
Yeah.
What he did was he gave him amoxicillin, he gave him metronidazole, he gave him all the primary, or what you call it, the SRP, and he gave him a very meticulous hygiene protocol to follow. And then he maintained. He called him after 3 months or 6 months,
Yeah.
and then he checked. It was a magnanimous improvement. The probing depths went down from 12 to, I don't know, 5, 4, 3,
Mm.
6, 7. Almost 50% of the improvement was, it was just because the maintenance was there, and the patient, he was motivated enough to do it.
Yeah.
And it was just different. Different. Although the patient had a lot of recession, but his main criteria was he had to fix those probing depths before doing anything
Yeah.
else, before
Yeah.
doing an
Yeah.
implant, before doing a bridge, before doing anything, before an endo as well. So he said that the maintenance is very important in perio. If you can't do that, you can't be a periodontist. But again,
Or,
it's very hard.
but it's not if you can't do it. It's if the patient won't do it. This is the point I'm
Precisely.
making. I can tell. I know all the things I need to tell my patients. The same things that a periodontist, a specialist, is going to tell the patients for the same disease. The difference comes when you see the periodontist. This guy in Italy. You're going to be paying thousands and thousands of pounds, dollars, dinars, rupees, whatever. Whereas if you're seeing a general dentist, you're paying much less. So the information is less valuable, and it's not going to hit your pocket as hard if you're wanting that. And that's why I think the big difference comes. Everybody should, in theory, know the things that we're supposed to tell a patient because it's not groundbreaking. Brush twice a day. Don't have things stuck between your teeth, and use a TP brush after you eat. That's literally it. That's all you need to do. It's not difficult. And TP brush, they
Yeah,
come again with a cap. You can put it in any pocket and take it with you. It's not difficult. It's just laziness. That's why I say, and
yeah,
patients and maybe some dentists don't want to say it to the patient, but most of the stuff in your mouth you did to yourself. It didn't.
precisely.
A few guys out there with unfortunate genetic conditions, there's a small incidence, but if you look after things properly, you're going to have a much healthier long-term outcome. And this is why there's guys who have their teeth to their death day, and there's people who lose them when they're 20. Mm.
Yeah. A funny fact over here in Pakistan is that we say this. There's this fallacy over here that dentists earn like crazy.
Mm.
They have they earn like crazy, and they have got Ferraris. Like, although we don't have Ferraris over here in Pakistan, but for us the Ferrari is a Land Cruiser, or a Civic of the 2018 model, or
Yeah.
a Corolla, a proper Lexus type Corolla. So they seem to say that every dentist would have that, and dentists charge a lot and all that stuff. But we don't. We don't charge a lot. We Over here in Pakistan, the thing is, if you get pain in your teeth, then the
That's
patient
when
will
they
come to
come.
you.
Yeah, they don't come before.
If they don't come before, and for just a proper scaling and root planing, and the question which they ask is, then will scaling make our teeth fall out,
Mm.
or will they make them sensitive, or will they lose color, or
Yeah.
will they lose the enamel? Like, and if a guy who's coming to you in a probably a motorbike, his expectations would be somewhat over here.
Less. Yeah.
It's easy to treat this guy in comparison to this guy, because
Mm.
this guy can have a lot of other things as well. His lifestyle would be different from this guy. So this expectation level over here is quite less, because in the OPDs, like in the you can say the hospital setups where
Yeah.
these students work, because the expectations over there are quite less. Like as
It's
I
free
talked
clinics.
earlier in the
Is it
no,
free?
not really. They're not. It's like you can say the institution clinics. Like you guys over there, you guys probably work on those mannequins, sort of dental mannequins for your teeth. Like you've got those class one cavities, class two cavities, class three
Yeah,
cavities. You make it on the
only
phantom
for
teeth.
one term. So one third of second year. One term in
Yeah,
second year, and then we're into the patients. But those patients
yeah.
don't
Same
pay.
over here.
Those patients don't pay for any of the treatment. They're coming for
Oh wow.
student treatment. Yeah.
Oh, okay. Okay, so over here patients pay, but it's a nominal amount. It's not the same as if it's in a private clinic.
Okay. Right.
Like over here in a private clinic, you would cost them around like I don't know, probably like 500 pounds or 200 pounds or 100 pounds, or depends on the experience of the clinician.
Yeah.
So over there in the hospital clinics, it's like pretty nominal. Like you can say a quarter to that amount,
Right.
maybe less than that even. So the patients over there, which they come, their expectations are quite low, and blunders happen. File breaks down in the root canals, or you extract some other teeth, which were. So this happens. This happens a lot, and it's just basic lack of concentration.
Mm,
And but the guy or the girl who does this, if they take the experience of it and then they remember it, that I'll not commit this mistake ever again,
yeah.
so that's how you learn. So yeah, the thing over here in Pakistan is that we want the patients to get educated about dental hygiene, and I'm talking about high class people. We want them to get educated, but again, they think as if they will come to us when they lose a tooth,
And we fix
or
it.
they have pain,
Mm,
or they have sensitivity, and the what we call over here is that when the water goes above your head, then they come,
oh,
and then
when they're
then
already drowning, right?
yeah, when you're already drowning, and then they come to us and then they say like our I don't know, our forehead is above the water, like save us
Mm,
somehow, save us somehow, like we don't want to lose our teeth, but we can't do it. Like we explain everything to them, and then we expect them, we give them time, like half an hour or 15 minutes or 20 minutes just for consultation, like on the x-rays and all that stuff.
yeah.
We do that. We explain them each and everything. And when that patient doesn't come, then you go like, is did I do something wrong? Did I explain them in a harsh way, or they got paranoid or
Mm,
something? But then you start to question your own self. Like, did I do something wrong over here? Because I thought as if this patient would come, and he seemed to be a good financially stable guy.
right.
But these things happen over here like a lot. I don't know what the problem is, but hopefully this will come to a closure someday. But yeah,
Maybe they went for a second
uh,
opinion. They said something that they liked. Yeah.
yeah, or maybe the cost factor as well.
Yeah.
And yeah, I don't know if this happens in the UK, because I've heard that NHS you have a certain dentist who has appointments of the patients, and then they can't go to another dentist. I don't know if
Uh,
that's true or not.
NHS dentistry is a mess. As much of a mess as any system anywhere in the world. If there's a bad system, NHS is on the same
Okay.
level of badness as that system. Uh,
Hmm.
so, but the issue that we have is we're obligated. So if a patient walks through the door and has signed up on NHS, you're obligated to do whatever treatment that patient needs doing, even if you're not comfortable treating that patient, on a personal level. If if they don't, what's the word? Certain patients don't believe what you're saying, right?
Hmm.
But because it's so difficult to get an NHS dentist, the patient will stay with you anyway because it's difficult to get an NHS dentist. Even if they dislike what you're saying or they didn't understand it, they don't say anything until something goes wrong, and then they try and sue. This is there's a very litigious suing sort of culture, and it can even be, I had a complaint and I've done nothing wrong at this point, where somebody just didn't like that I gave them certain options.
Okay.
Really, really, yeah. So I said, look, well, this tooth, I think it had a crack off the top of my head. It's quite a while back now. It had a crack, and so I said, well, I can see the crack around this amalgam. Probably the amalgam needs to come off. It's already quite a large amalgam, so we can't get another filling in there. Once I take the amalgam out and clean it up, I can promise you it's too big for a composite. It's too big for an amalgam. So we need some form of onlay. I said, look, on the NHS, with finances and all this sort of thing, you can get composite crown, composite onlay, which is fine, do the job. It's not as strong as a porcelain Emax. I said porcelain Emax is a private treatment. It's an expensive crown. It's not covered on the NHS, right? This guy
Mm-hmm.
complained because I was profiteering. I just said, look, it's not as strong. I just told you can tell the truth to some of these guys if they dislike you, the way you look, the way you said something, uh, or they just they'll complain, and that's the problem. Whereas in Pakistan, it sounds like if they didn't like what you said, they go to someone else and find someone who they like what you said, and yeah, it's
Yeah.
different problems, but yeah.
Yeah. As you said about the composite crown thing, over here in Pakistan, it's just like Emacs and these zirconia crowns and all the new things which are happening.
Mm,
You don't see them being, taught in universities over here. Like some of them may teach them, but it should be a norm. Like research papers. The problem over here is that we're like far back. I would say we're like 30, 40 years back when it comes to theory.
mm.
And I was just discussing with this topic with someone. So I just said to them, we're like in theoretical point of view, we're like miles back from abroad, like UK, US, and the research which you guys do is like on a different level. So, but I don't know I I don't know if the teachers don't have the experience with that material or that stuff. I see people doing Emacs rounds, onlays, inlays, like very seldom,
I think it's
and
interesting, yeah. First of all,
and
it's expensive, right? To have an Emacs milled, it's expensive, or
yeah,
pressed. So maybe they've
and
had less experience around that way. And to be honest, I
yeah,
wasn't taught onlays in university. Not really. I learned that
hmm
off my own back after university. I'm sure if I'd spoke to certain clinicians who were teaching, they would have been able to teach me about these things. But we didn't learn to that level of detail. We learned to the very safe beginner standard, very, very beginner level dentistry. And then everything
yeah,
else you pick up afterwards.
yeah. I'm down with that. Like
Mm,
it should be the basic level of dentistry when you're doing your preclinical years and clinical years when you're in your BDS program
mm.
or DDS program. But then again, the this practice should be a norm at even at university level, because I don't know, it makes you think as if only a porcelain crown is not the treatment for this, or only a zirconia crown is not the treatment for this. If the occlusal level or the occlusal area you've not trimmed it enough, and you think as if an inlay can do the job, so why not do an inlay? Or why not, if the crown is, you have a lot of space there, but if you think that an onlay can work, so do an onlay.
Mm.
Or if you think a composite can work with the right anatomy, so why not do that? Because again, the less invasive, the more progressive the treatment is, or more the long lasting, or the prognosis gets better.
Yeah, my
But
feeling is you should, at this point, there's no real need unless you're replacing an old conventional crown. No new
mhm,
dentist, and apart from the very, very worst cases, should be cutting a conventional crown. I don't see any need to do it, because you're just
mm,
whipping away any sort of enamel ring that was there, gone.
yeah, you're doing that, and plus, you know, things have gone like way forward now. I
Mm.
follow this dentist. His name is he's an Indonesian, I believe. Rizzi
Oh,
something.
Rizal.
I don't know.
Yeah, he's a good friend of mine.
Yeah,
United fan.
he is just an amazing guy.
Yeah.
Like I follow his work. Like every day I'm on the Instagram and his story comes up and I go like, yeah, this guy has done something crazy. I open that up and it's like, it makes me so happy.
Mm,
He constructs composite crowns. Like the other day, there was this. I was watching this story. He saved a premolar.
yeah,
It was like a whole swelling was on there. Then he, did some pottery, I believe. He made the crown come out of the gum of the gingiva, and then he, did the root canal, and then placed a post, and then, did the crown and everything. But yeah, restorative dentistry over here in Pakistan, if the PDR is there, most of the people what they do is like, okay, let's get it out.
yeah.
Like
I
if
think
there's
he's
no,
good for
if
you
there,
guys. If you're working under financial constraint, then
yeah,
Rizal is the perfect guy to use as some sort of role model because he is in the same position. His patients can't afford Emacs, they can't afford zirconium crowns and all this, fancy dentistry. So he, instead of extracting the tooth, this is what he said to me. He goes, "Look, I'm not going to take the tooth out when I can save it and keep it in occlusion and have the tooth stay there. Maybe, hopefully, he tells the patient, look, this is long-term intermediate filling. Best chance, best case scenario, you come back when you have some money, and we put a crown, we put an onlay. But if you haven't got the money, this is gonna do for now. Instead of,
mm.
oh, I think some people in the West are very much of the mindset, oh, it's too big for. Sorry, that doll's killed me, man. That I'm still feeling the effects. Um, yeah, but some people in the West maybe have this idea of idealized dentistry and don't understand the financial constraint that people in developing countries are. Um, because, for example, the if somebody can't afford a crown, does that mean we have to take their tooth out? I
Precisely.
think that's a very bad situation to be in, and I feel like that's where a lot of people maybe that's where their mind is at, where they go, well, gold standard treatment is a crown. So I'm going to do a
Yeah,
crown or I'm going to take it out. It's a all or nothing. Mm,
yeah. I've seen patients over here. They've gone through this all on fours or full mouth rehab. Like I don't know, maybe their experience was more or whatever. But then you go for the before and after X-rays. You see the OPG and you go like, yeah, there's a good amount of bone over here, and I don't see any mobility,
mm,
and I don't see stuff which needs to be changed. I probably they might need some restorative work, a class two cavities there or whatever. But I've seen people taking out teeth and then placing just for the sake of implants, just for the sake of money, and
yeah.
it's just so mind-boggling. I don't know what's wrong. And the patient, like there are some patients like this as well. You give them
Mm,
the opportunity for an implant and they go like, okay, fine, we'll get an implant, and as long as it makes my occlusal function get better,
yeah.
I'll go with the implant. I don't mind, regardless if you take my natural teeth out. Like there's no
Do you know
substitute for
why?
your natural tooth.
Endo is hard. This is why. Endo is
Endo
hard.
is hard. Endo is hard.
And
Yeah.
that's why I like endo. But
Hmm.
and then there's all these studies which are correct studies, but and they say 10-year success of an implant is 98% or something, or 20-year
Hmm.
success. Well, whatever it says, and it's a very high percentage, and it rivals an endo. But they're not an equivalent. So a tooth is always better than an implant.
Yeah.
From my point of view, if you can save the tooth, save the tooth, and a specialist level endo is going to be better than, for me, a specialist level implant in the same mouth, because given the patient um, that tooth for another 10, 15 years, which means you've got 10, 15 years more use out of it. What happens if there's no osseous integration with this implant? Now you've taken the tooth out, which could have been saved, and you can't have an implant because it failed. Now you're there with a spoon denture.
Yeah. You talked about the success rate. I happened to come across a patient, and we had the OPG done. She came with the swelling on probably the left side of the mandible. She
Mm,
came with the swelling. There was a lump over here, and then we examined it. We felt like, all right, what's the problem here? Why is there a lump? Probably a submandibular gland swelling or whatever. So we got the X-ray done, the OPG. There was a huge cystic sort of a lesion over there, And what happened was an implant was placed like this in that cavity. Somehow the osseointegration did not happen and was just lying dead there in that cystic cavity. And that cavity was covering the whole, probably the mandible, extending from probably like the lower canine to the lower six, lower left side six. And so we had to plan a surgery for that because we couldn't just leave it there. And so because of that, the infection was so much, and patient did not have any pain.
Mm.
Patient just came with a swelling. She felt like, all right, oh, this is a swelling. There's the asymmetrical face, and she was, a good financially stable woman.
Yeah.
So then she went like, all right, I have to go for, for
Surgery.
outings and for meetings and
Mm.
for social
Okay.
gatherings and all that stuff. So then she felt like she only came for that reason. And when she got to know about that, oh right, this is a whole big swelling, gigantic swelling. We have to take it out by surgery, like a proper surgery. You have to go in GA. So she felt a bit, you know, she took a step back and then she was like, okay, I did not know about this. What happened and all that. So the implant, I don't know what happened. Probably the implant did not osseointegrate in the bone, or an infection was already there. So we did the whole surgery. I did this with the same guy, the oral and maxillofacial surgeon who I worked
Yeah.
with. So he did that. He took out all the trash material or the cystic lesion, all that stuff out. And what he said was, again, his experience came into play. He said that I might be needing a lot of bone for this, and you know the the artificial bone. So he said that I might be needing a lot of bone for this, the bone material. So he ordered that bone as well. So he used a lot of bone, and he filled that cavity up. He said that if this lesion would have been there for another 2 or 3 months, she would have lost her mandible from the left side.
Yeah. I mean, I've seen. There was one particular case I remember that we were taught about on one of these study days, and this is one of the other big issues I have with some parts of UK dentistry is we don't take OPGs routinely.
Okay.
So
Mhm.
this patient come in, been going to see the dentist for 18 years, till university, went away to university, came back, finished the degree, nice, brilliant, then
Mhm.
started finding funny feeling over here. And then, eventually, somebody, I don't know what happened, they did an endo or something like that, and it didn't fix it up. But in all this time, no one did a proper chart or something. And this is me. This is a anecdotal. I don't know the exact case of the story of this case or something, but this is what I heard. So she only had 6 to 6 on the bottom. So first molar to first
Okay.
molar. No one thought where's 7, where's 8. So no one did any further investigation. They're just like, oh, it just has 6s. Okay, cool. Uh, there's double impaction, horizontal impaction with the dentistry assist, and it
Oh
was
wow.
wafer thin on the mandible by the time it
Mhm.
was found. Both of those had to be taken out. I don't know what happened. I think she ended up with plates to hold everything
Okay.
together because
Yeah,
there was
yeah, yeah, yeah.
nothing left. Nothing left in the mandible.
Yeah, probably a recon plate, I believe.
But just by, a
So,
simple thing, early doors, if you're
mm,
15, 16, or 14, or 12, even 12, 13, 14, oh, this is funny, this it's a bit slow, and if you take an OPG at that point, just once, see what's going on, then you pick these things up. But people don't, and they do the easy thing, and in and out,
yeah,
in and out.
do they? Uh, I wanted to ask, like, do they do that because of the dangers of radiation? Like,
I think there's two problems. One is NHS dentistry, where
okay,
you have to see lots and lots and lots of patients to make any money. Otherwise, you're in negative, and if you don't hit your target, sorry, this dial really done me, man. And if you don't hit your target, then you have to pay them back. You have to pay the NHS back the money that you didn't do. So you
oh,
lose. So yeah, you might have to pay extra back to the NHS because you didn't do as much as you said you were going to do, or the target. So that means you have to work faster and faster. Little things that a little bit of thought you would catch. they go out the window because you have 6,000 UDAs to do, or 8,000, or whatever number of treatment to tick off. And the other thing is, yeah, we have very radiation averse, I think, compared to the States as well. But I'm of the feeling, and I don't know if this is right or wrong, that at least once when you see a patient the first time, take an OPG, see what's there, just to screen for things, because the time that you miss it is, catastrophic to the patient, as opposed to one OPG, which now with digital OPG, the the exposure isn't so high with a digital,
Mm-hmm.
all the new technology, very very low levels of radiation on these machines. The old analog ones, and they were terrible. They had much higher radiation, but that hangover from, oh, it used to be very much lots and lots of radiation for an OPG in the old days is stuck now, even though the technology has moved way beyond that point. And the same
Mm-hmm.
with cone beams now. I would,
Yeah.
for an endo, uh, any molar, I would take. If I've not had the chance to work with a cone beam in surgery, but if there's any molar, I would take a cone beam now, I think, because you can see if there's MB2, you can see if there's MB3, you can find out, all these curvatures that you didn't see before, lateral canals, all these things. And then it's also self-selecting, because if you're just a general dentist and you see 90-degree curve, or some funny anatomy, I can't do this. So you say, okay, well, I'm just going to refer it, and you don't even bother trying to do something, and you don't bother trying to do something because the likelihood is you're going to mess it up.
Yeah.
And that's my feeling. I think there's a lot of ways that dentistry in the UK can improve, and probably the best way to do that is to take it off the NHS. I think NHS should be an emergency service for dentistry, and that's about it,
Mm-hmm.
because they're pretending there's enough funding to see everyone, and there's not.
All right. So
Mm.
I would like to talk about this because over here in Pakistan, you can say the mindset is that when the people who go from Pakistan to England pass their worries and they're practicing dentists over there, they come with this this good news that you have three ways to practice. That's like your private practice,
Yeah, brilliant.
then there's your NHS, then there's your NHS practice, and then there's both.
Yeah,
So they give us this, all of the, you can say, the silver linings. Uh, like they just mix it up and they present to you a chicken roast that this is brilliant stuff. You can have this whole chicken roast if you do this. If
yeah,
you go for the
sure. I think, yes, you have these three options, but
hmm,
if I am a dentist from anywhere else in the world, I'm going to say, look, if you're going to come here with some real skills, have done some, further training, have a good case portfolio, proper
hmm,
case portfolio on the level of Rizal's, on the level of these guys, and
hmm,
and if you're going to do something, do private practice, because NHS dentistry is more stress than it's worth. And this, I'm not in a job at the moment because COVID, and then we have all elderly people in the house, so I decided not to go back when things opened up again. And
hmm.
when I go back to work, I won't be picking any NHS job.
Right.
I would rather be a podcaster on the internet and earn £24,000 a year, or instead of 50,000 being a NHS dentist.
Okay. Because this NHS thing, like it's branded over here as if it's the best thing in the world.
For
Because
medicine, yes, medicine. The hospital, for GP, for
mhm,
this side of things, and for the patient is brilliant. For someone who's a young dentist wanting to get on in their career, it's
mhm,
like the death sentence for your career. Your career is finished. No, it's sad, because the people that you treat are nice people. They don't have a lot of money, but at the same time, you don't just go into dentistry to almost do charity work. NHS work is like charity work from my point of view, because you're stressed out and it's not worth the time that you put into it for what you get out. Because I was coming home tired, thinking, oh my God, I've got to do so much treatment the next day. And if I don't get enough treatment, I have to book in more patients into a shorter time and squeeze it and do more and do more. And that's not the way that your career should be, because dentistry can be the most enjoyable thing when you have time to think about what you're doing and you have time to craft these fillings into beautiful piece of work, and do endos correctly and nice dentures and nice, well, perio, someone else can do my perio. I get bored by it, but you can do my perio, bro. But it can be a rewarding career, but not if you're so stressed that you have a target to meet. Does that make sense? I don't know.
Yeah, actually, because again, over the I don't know, the standard of dentistry is so, like, when they put a comparison, like, even if, like, over here when we do our house jobs, we are bombarded with patients.
Yeah.
Like, if if a person if you have a group who's rotating in operatives or endos, they're doing fillings, they're doing core buildups, they're doing everything from chamber openings to canal locations to everything from core buildup to basically everything of endo.
Mm.
And then they have this time. We have no microscopes over here. We have no intricate instruments like the loops. We have to buy them on our own. And, people don't do that because, again, they're just doing beginner stuff.
Yeah, money. Yeah.
So, yeah, money. The main factor is the money. So, what happens over here, we're bombarded with patients, and the efficiency, it goes down.
Mm.
It goes down like anything. Like, if a person is doing 3 patients in a time span of, I don't know, 5 hours, so I would be really happy to do 2 patients in 2 hours or 3 hours rather than doing 6 patients in 4 hours, because my efficiency, it goes down. And I've seen this happen with a lot of
Depends on
students,
the treatment you're
like,
doing,
who,
obviously. If it's just a simple
yeah,
filling,
if you're
then
doing
yeah.
like sixes, if you're doing an upper 7 or an upper 6, then you have your indirect vision and all that stuff. Then you have to put your rubber dams on, and if the patient is, not cooperative enough, and, you put your suctions in, and then he gives you a gag reflex. There are a lot of things, a lot of factors. So what my point is that the efficiency, it goes down like anything, because
Mm.
it happened to me as well. And I was so bad at I was thinking really bad for the patient, because I tried my best to do stuff, or to my utmost, highest level.
Yeah.
Like, the way I was taught, I used to replicate that in my work. But, there was this back feeling that, I would have done it better if I had 2 patients.
With
If
more
I had
time to spare for each one. Yeah.
Yeah, exactly. Because then we had this in the OPDs, we have this area called as emergency, like the ER, the emergency room,
Yeah.
where we have to treat patients who come in with pain. Like, you can either give them painkillers and let them go home, or if they come with a huge swelling or an abscess, send them to surgery first. They evaluate it, then they come back, then they go like, no, open the tooth, and, just go about with the pulpectomy or the pulpotomy or whatever. But you have to do it, because people are posted in the emergency room, and they have to do it whatever. Like, then the you can say the demonstrator or the senior registrar, he comes in or she comes in, and they go like, okay, what is wrong with this patient? He is in the emergency. I go like, ma'am or sir, I'm bombarded with patients. I have appointments and all that, but you have to do it. It's the emergency because you're in the ER. So, you know this is a whole different thing. Like, it makes you, get, it arms you,
Yeah.
like, for a difficult situation. But again, the efficiency for me, it goes down like
But this
anything.
isn't the way to
That's
learn, I think. If you're trying to learn something, how can you learn something when you're already being rushed into doing it incorrectly?
Yeah, exactly. Because this is the thing which I always like, take ample amount, like, take enough stuff on you which you can do. Like,
Mm.
it's so hard. Like, you have to meet up with us. So again, efficiency, main point for me. Like, it goes
Yeah,
down.
the quality of work goes down the faster you have to do it. I think that's the same everywhere. I think that's the big problem we have. It sounds like you guys have the big same issue, but don't get me wrong. If you come to the UK and you have good contacts and you manage to get, and you have a good portfolio and you get yourself towards a private job, the quality of work you can do there is very nice. Remuneration is very good, but it's not easy to get those jobs even for guys here. You have to have exceptional um, communication skills and selling skills, as well as being a technically good dentist. It's all the things rolled into one you need to have. Whereas an NHS job, it's like, quick, 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 quick. Get it finished, get it finished, get it finished, and the quality matters, yes. But uh, if I tell you, look, if you don't do enough, then you have to pay back the NHS. Then you're going to be thinking about doing things faster as opposed to doing things right, which is why I didn't like, so I don't do it anymore.
Yeah, yeah. Because again, the even talk about endos, we still do endos manual files, the manual K files, H files,
Mm.
like. But I have worked with rotary instruments. I've worked with Dentsply Sirona files, and they're pretty good, and they make your work so easy. But then again, at the student level, I say fine, like, give them 3 or 4 endos, like they get the hang of the manual file, the muscle memory, it gets there. But then you should shift them to rotary endos, because it's the need of the hour right now. You want us to work like crazy, like 6 patients a day or 5 patients a day, but you want us to do the
By
manual
hand.
filing and like go on and on and on and on and on, apply EDTA, shed more dentine, and you're basically traumatizing it. You're not going with the watch finding and all. Like, you tell me, if we do 6 patients a day, would you go with the watch finding, go simply down and then anti-clockwise, clockwise, you're doing it with this motion, or uh, you would do it like this? Like, I've seen
It's
students
Yeah,
do it
it's not
like
right.
this.
It's not the right way to do it, and you're gonna
Yeah,
ledge. You're gonna do separate files. You're gonna do all
exactly.
these things. Is it true that in Pakistan there's or maybe in Indian subcontinent there's issues with people not using rubber dam for endos, and because over here this is enough to, if you get caught not doing rubber dam in the UK, you're finished. You can't practice again.
Yeah, it's funny because over there in the UK, the rules and regulations are so strong, and they're so regularly followed or strictly followed. That's the whole reason behind it. Like, over here in Pakistan, this Indians have, I don't know about India, but in Pakistan, you go, like, there are patients who refuse it. Then you have a reason to not apply the rubber dam.
Mm,
But there are cases now. It's slowly changing. I've seen a lot of institutes now going with the rubber dam thing, because I wasn't taught how to use rubber dam in my final year.
right.
In my final year of when I was doing endodontics, but then I subscribed to pages, and I saw it on Instagram. Like, what is this thing? This blue
The tooth is still dirty down the bottom of the canal. It doesn't make any sense. And again, maybe it's the money thing. Maybe that's an issue. But it sounds like the patient won't accept it. You just tell them, well, no, you can't have this treatment now because it doesn't work without. And that's how I feel. But I don't know. It's a different landscape in different countries and different systems and things. So hopefully you guys get towards the end. I think it's easier, by the way, with the rubber dam on. 100% from
Yeah,
operator.
yeah, it saves you. It saves you from a lot of saliva,
Mm,
from a lot of gag, and from a lot of all of those bacterial influx, and everything goes so smooth.
yeah.
Like, you have to, your whole concentration is on one tooth, like, because it's the only visible tooth that you're working on.
Mm.
You don't have the, because it's said, if you look at one thing for about 5 to 10 seconds, your retina, it takes the image, and it makes it, the image stays there. Like,
You're
this
focused on
usually
it.
happens when you're doing, yeah, it usually happens when you're doing your shade selection,
Mm,
and you have to change your, you have to move your eyes after like 5-10 seconds, or you have to look at a different color, because your eye memory, your retina, your rods and your cones, they take up that color.
yeah.
And then you go like, all right, when you're doing, probably an A1 or an A2, you go like, okay, this is more lighter or this is more darker.
You get the
So
if your nurse is a lady, get the girl to choose the shade because they have a better rods and cones ratio or something. and their shade selection is literally better than our shade selection. We can't see that level of color that the girls can see. So that's usually what I do. I get I say, what do you reckon? And then I let
Yeah.
her choose the shade because they've got a better eye for these things, you know.
Yeah. That's just research proven,
Mm.
man. Like we can't do anything about it. Like it's not a
You can also
feminist thing
blame
or
you can also
you know.
blame her.
Yeah, you can also do that as
Yeah,
well. But yeah, mostly they have a good aesthetic sense, and yeah, that's a really good point. That if you have your nurses over there, well, over here in Pakistan, we usually have male assistants or dental assistants,
mm.
mostly in clinics.
Right.
So we have to just trust our own
Judgment.
choices,
Yeah.
and we yeah just our own judgments and all. So yeah, but yeah, whole I can go on and on over here. Like a whole lot of faults, a whole lot of good things, a whole lot of faults.
It's
But
the
yeah,
same everywhere,
I
right?
don't know. I don't know. It's like I want to break this barrier. I want to do things like which makes this dentistry go up in Pakistan. It is going up. It's not like as if we have dentists over here who do full mouth rehabs, like crazy full mouth rehabs,
Mm.
like crazy occlusal connections and new things, laser work, veneers of the highest quality, Emax crowns, crazy, crazy stuff. But then again, there's a whole gap. Like those dentists are over here and some dentists are over here. There's no here.
There's nothing in the middle.
Like, yeah, nothing in the middle. There's a whole void. Like it's literally like this
Mm.
whole void, this space. Because the information is not saying, you know, you go to a clinic, you go to a super high, super earning clinic in Pakistan over here. Then there's this barrier, like that guy knows about veneers, Emax rounds, onlays, inlays, endos, microscopic endos, perio, crazy stuff.
Yeah.
And then there's a student who's just done his VT or house
Is
job, or
this the drill?
he's like in his first. Yeah, what is this? What are these?
that's that's
What is
that's
this
a
file?
mirror.
What is this instrument? What is this instrument? Why is this file moving like this? What is torque?
Yeah.
What is what is this whole instrument doing over here? So that guy who's at the top of his game, he has to come back to the level of this guy and teach him from the start, from scratch. And people don't do that
It's
over
too
here.
much
They
effort.
feel as if too much effort, and they're going down on their level, which is the whole problem over here. I've seen a lot of kids suffer from this.
Mm.
I've seen their teeth when they're preparing their teeth for crown preps and all. The teachers pick them up and they just throw them. What the hell is this? What have you prepared and all that? That guy is doing that crown prep for the second or the third time probably.
Yeah.
That's a
He already
phantom
doesn't know what
tooth.
he's doing. Teach him. Yeah.
Yeah, it's a phantom tooth. An enamel, the tooth enamel and the phantom tooth are totally different things. A
Mm.
phantom tooth is probably a plastic one,
They're
and
hard to
the
cut.
real
They're
tooth
hard to cut, those plastic
hard to
teeth.
cut.
Yeah.
Yeah, you've got to have the right amount of the right burr, the right
Torque.
it shouldn't be worn
Yeah.
out. It, the right amount of torque. The oiling of the handpiece should be there. Everything should be top notch. And then when that guy or that girl cuts the crown and he commits one mistake, and they go like, "Oh, what have you done?" And they just
They
throw it in front of them.
lose their
Like
minds. Yeah.
they lose their minds, man. I don't know. It's like it's so hard on them. It's there are teachers who help them, like they hold their hands and do that. All right, you have to do it like this. You have to use the burr on this different burr on the lingual side and
Mm.
this different burr on. You have to prepare the chamfer margins or the shoulder margins. You have to do that, and there are teachers like that too. But you're not supposed to throw their teeth, man. You're just not. That's just not right.
It's people who
You're just
shouldn't be teaching. It's they're maybe talented clinician, right? Like they can do it,
yeah,
but they're not a talented teacher. There's a big
yeah,
difference between these two things. Just because you
yeah,
can do an
yeah,
incredible veneer case doesn't mean you have a clue how to tell someone else how to do one. Other than maybe if you just
yeah.
record start to finish. That's probably, if you're that kind of guy, you just need to record your work and everyone else can just watch it and then maybe we can learn from that. But if you don't have the temperament for teaching, then there's some guys who just shouldn't be anywhere near a student, uh, just because of their temperament, being very poor and angry and, you know, that kind of a personality.
yeah, we usually have this. I remember in our house job days, like we used to go like whenever we used to enter this one department. So we used to ask the assistant. We used to knock the door and we used to ask the assistant, "All right, is the HOD's mood fine now? Can we come in or not?"
Mm.
Then he goes like, "No, no, no, go from here, go from here." Like from the there used to be a like a transparent glass thing. We used to go like we used to stand up on our toes and then we used to go like, "All right, is the HOD fine or not?" Like this was our symbol to the code words. We used to be like, "No, no, go, 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 don't come here, don't come here." So we used to go like, all right, fine. Like even if we had a question to ask, but if the HOD's mood, the head of department wasn't good,
Just
so we
leave.
couldn't ask the question. Yeah, we just used to leave that area. So
Yeah.
then then at some point of time when his mood is good, he calls you in his office, and you sit and you chill, and then you talk about stuff other than dentistry. Their mood fluctuates like anything.
Mm.
So again, that
He's eating
affects
too
your
many carbs. He's
relationship.
having the peaks and the troughs, the peak, mood swings. There's too much.
Yeah.
It's too much added sugar in the diet.
Yeah, yeah. Then we go like, yeah. Probably he didn't do his breakfast. Or
Mm.
probably he had some issue in the car, and then we we make up these things in our minds. So yeah, a lot of things. I learned a lot of things over there in my house job days, especially the PR thing, the personal relations, the way you talk to your patients,
Mm.
the way the way you document cases. Over here in Pakistan, a big void is over here. We don't document our cases that well.
Yeah. Start of the case, in between, middle, halfway through, or etches on. Take a photo. Cusp one, cusp two that I've built up. Take a photo. End of the day, you have 100 photos. You look at them, go, oh, this is good, this is good, this is terrible. Then you can learn from it, and then you
Yeah,
learn from yourself.
you just critique
Mm,
yourself. You go like, all right, this picture is not fine. Even if you use even if you use a mobile phone, there's a certain a distance from where you have to take your pictures. This should be taught to students at the junior level.
mm,
Like if you want to take pictures, like proper pictures, you have to use your reflectors, your retractors, your every black mirrors. It
yeah.
gives you a good, it makes the teeth shine out. It makes the gingiva look good. You don't have to edit a lot. So people who know this over here, they cash they cash on it. Like they give courses.
Mm.
I know it happens everywhere in the world, but they
Same
cash on it.
everywhere.
But
Yeah,
this should be a norm. Yeah, it should be a norm in the university, because
it's a difficult skill though.
it's
Photography is it's a it's a confusing skill when you initially start, and it's something that
yeah
I'm really into. I mean, you guys know, if you've seen my Instagram and stuff, photography is as much as my interest as anything else. Which is why I've gone into video kind of content and photography content and all these kinds of things. And to start with, it was very, very confusing. What's an f-stop, what's ISO, what's shutter speeding doing, and if I change the shutter speed, what do I have to do to the ISO? And then it it's all these things of checks and balances, and it can be very confusing for guys. uh, and yeah, I think this is the thing again. You almost want a photographer to teach you, not a dentist, because photography is a whole other world. There's
yeah
so many things that you could buy, that you could invest in, different ways to take different photos, different styles to, make different things stand out, and all sorts of things, and how to frame something. Um, so yeah, I think it's going to be very difficult to then add that into a university curriculum unless you bring in a photographer, and you have a dental photographer is a new lecturer. It's a new, maybe throw
mm.
out some of the physiology and we'll do photography instead. Maybe that's the best way.
Yeah, no, what? Yeah, but I think it should be a norm in a sense, because you're preparing them to hit the
Yeah,
dentistry
it should
world, the
be. Yeah.
professional world. Yeah, because again, marketing is something which you need to do in order to make your work go crazy, like make people to watch your work. Like Rizal does it. Rizal does it so well, and I follow some other dentists as well. There's Dr. Atia, I
Yeah,
believe. He's
David's
in
great. Yeah,
Australia.
he's a lovely guy.
Yeah, yeah, he does that so well. Then there's Dr. George. and he does it so well. And different dentists, and they have this skill of photography, which makes work, if 50% good, it makes it go like 200% good or
Mm.
250% good. Because the eye, it picks up those things which you want to focus on. The beauty lies in the eyes of the beholder. It's just as simple as that. So
Yeah.
if it looks good, so yeah, it pleases the eye. So I think photography should be there. I myself am quite inclined towards this. I wasn't taught this, but I found a book called as Lit by Dr. Miguel Ortiz. Amazing book. It's the it was one of the best sellers. And I don't know if you know about Professor Nguyen. What is his name? I think he's a periodontist in Harvard.
Yeah, I know of
Thomas
him. I've not
Nguyen.
spoken to him previously. I've spoken to a
Yeah,
couple of the other guys, but not I haven't spoken to him yet. But yeah, I think photography is super important. But even just to improve your clinical work, you don't need to have Rizal level photos or George Cheetham level photos. You just need a record of how it looked, sort of.
yeah.
It doesn't have to be the most incredible, angled photograph, which is stylistic and stuff, and that kind of thing. It just needs to be enough that you can go home and look at it and say, actually, yeah, this was good, or no, this was
Uh,
what I have to improve.
if I you if a person or a patient makes some sort of claim that you did this wrong or you
Yeah,
did this
you have
right,
the
or
record.
there's some sort of a problem, you have the record for it.
Yeah, and
Like you
scanning
can
into this as
show
well.
them, yeah, you have this, you had this tooth in the start, you had this problem, I did this, and
Mm,
we completed a whole case. This is the whole intraoral photography. You can take a look at it, and we had the video of it as well. You came in our clinic, you sat down on the chair at this point, we did this stuff. And in Pakistan it's not on the same level. Like the patients don't do
it's
that, some
coming.
of them do
Is
that,
it
so
getting
you have
there?
it. Yeah, it is
Mm,
getting there, because again, the same thing. The the high class is there, the lower class is there, the middle class is there. So
mm,
the lower class is trying to get in that level of the middle class, and the middle class goes. So this class over here, the middle one, they're progressing into it. The higher class, they demand, obviously,
demanding
if they're
more.
coming out of a Lexus, they demand more,
Mm,
and so you have to treat them in that way as well. So it is getting there, but again, if you have the records, you can get yourself out of it. Because over here, you don't have lawyers to sue.
right.
Like you don't have dental lawyers. Like they
To
can,
be honest,
or
I'm
some.
all for this. Having dental lawyers and stuff like this. If something goes wrong. But what I'm not for, and this is the problem in the UK and I think in the States, is they have something called no win, no fee. So
Okay.
this means that they just have a go because they're not paying. The patient just has a go. Nothing's really gone wrong, but what if? Maybe something they missed, something small that hasn't really caused any issue, but we'll just have a go. And if they lose, they don't have to pay any lawyers' fees, but someone has to pay these fees, and it's always the other side or someone. So I'm all for it. If you really think you've been done wrong, then you're gonna find a lawyer, and you're gonna pay for it, and you're gonna probably win if you have had something done wrong. But for these guys, there's nothing really's gone wrong, and they're just chancing it. They're having a shot from the halfway line. That's what it's like.
Yeah,
This is
it's
exactly what
just
it's like.
purely
They're
luck.
just taking a pot shot. The Steven Gerrard, they're shooting from outside the box. He shoots 200 times, one goes in. This is how
Yeah,
it is. And then
or
the
and then you're like David Beckham, and then you score your against Wimbledon.
uh,
So yeah,
but it's that same idea.
it's
Yeah.
good score basically.
Yo, it's been two
Yeah.
hours, man. 2 hours.
So it's just
Wow.
wow.
Shall we
I'm
wrap it
not
up
I'm not
there?
tired at all. I'm not tired at all. Just saying.
Uh, let's wrap it up there. I think 2 hours is a nice
Sure, man.
length. Um,
Yeah, yeah.
and I think we can definitely do something again, maybe a bit early in the day for you because you're getting pretty late out there. So
Yeah. I'll probably stay up because I'll have to
Fajr.
pray
Yeah.
Tahajjud and Fajr. Yeah, I'll probably stay up till 5ish because
You've got to get
with
up.
the
You've got to get up pretty soon to watch the game, though, man.
yeah,
We're
I'll get up. That's not a
12:30
problem.
kickoff.
Yeah, no, that's not a problem. I'll probably wake up around like 10:30 ish, 11 ish in the
Okay.
morning. So yeah, have a good breakfast and then just basically sit in front of the laptop because again, no work, COVID. Probably
Mm,
do some content writing or do that stuff because quarantine has made me do that. So yeah, and probably I might plan for the show. So yeah, let's see. But yeah, I'm looking forward to the weekend. Probably we can do something against Brighton. I hope. Fingers crossed. Let's
yeah.
see. Not not really confident, but yeah.
Well, I think we should have a good chance because we've had another week, 7 days of training. And I think that 7 days hopefully is going to be enough because the guys that came back, Paul Pogba, he had coronavirus, man, and he had 4 days of training,
Yeah,
4 days of training plus coronavirus, which is
yeah,
respiratory. I'm not surprised the guy was sluggish when he was running around. He's trying his best, but he's clearly not fit. So I
yeah.
know that,
Everybody was.
yeah,
If you look at Liverpool and Leeds, Liverpool versus Leeds, and you saw how Leeds, they were just on the brink of winning. If Rodrigo wouldn't have done that foul
well,
in
there
his
was some dodgy
finish, it
penalties that
would
get
have been a
given.
draw.
Yeah.
Yeah, that was such a schoolboy error. I was like, even on the show, I said that a guy from Bielsa's team, you're not supposed to do that. Like it was a
Mm.
schoolboy error. Like 4-year olds or 5-year-olds don't even do that in the box. If when it was like I think it was like around 88th or the 87th minute of the game,
Yeah, we
and
know they
Rodrigo
like to go to
does
the
that.
floor. We know they like to go to the floor every chance they get.
Yeah,
There's extra gravity
yeah,
in
they do
Anfield.
that. Yeah, but again, it was just purely luck, man.
Yeah,
Again, my brother and sister were watching the game, and I was like, yeah, this is how the defending champions open the game, open the Premier League. Like they're, you know, doing, getting a on Anfield and stuff like that. And Rodrigo comes up with this foul, and I go like, say that.
yeah. To be
But
honest,
yeah,
I don't think they're
yeah,
gonna
let's
win
see,
again
man.
this year. I don't. I think they
Yeah,
were
same.
very good last season, but they outperformed their capacity by a huge amount, huge amount. And I think Man City, a couple of injuries kind of ended their season. I would be very surprised if Liverpool win again, and
Yeah,
very
same here,
suspicious if they
same
win
here.
again. To be honest.
I I I don't know. I have this feeling that Tottenham might do something different this year because again, they're linked with Skriniar now, and then they linked with Milik as
Mm,
well. And I was just reading before the podcast, Fabrizio on his story said that talks are going on for Ruben Diaz, Man City. Otamendi is being offered to Benfica,
mm.
and so yeah, I don't know. Then that Sevilla guy, the centre back, I don't know what's his name, the young guy,
Oh,
Konde.
Konate or something. I can't
I don't know
remember.
what his
Yeah, yeah,
I don't know what's his name. So he's in line as well to join City. I don't know what's happening. Apart from us, everybody is signing players.
yeah. No, but I think you're right on Spurs because I think people. I know he's injured at the moment, but Gareth Bale.
Yeah,
Look, put it this way: I don't rate Mo Salah. If Mo Salah can score 40 goals in the Premier League, I'm convinced Bale can score 50 or 60.
I don't know,
That's
man.
how bad the
Yeah,
defense is.
yeah.
There's no
I
good.
don't
There's
know.
no good defenders in the Premier League. That's my thoughts.
Yeah. Uh, I what I thought was in the Premier League, the defense is not that good. Yeah, you're absolutely right about that. Look at Chelsea; their attack is like crazy
Stacked.
good,
Yeah.
but again, you see blunders from Christiansen, you see blunders from Rudiger, you see blunders from Zuma, and similarly everywhere, even Liverpool's defense as well. Only Van Dijk, and he's been exploited this season.
Yeah, he's a
Like
good defender, a really good defender.
yeah,
But put 10 years ago, he doesn't even make the top five teams. 10 years ago, no chance.
yeah,
I mean,
yeah,
if
yeah,
he was that level, And 10 years ago, he was 18 years old or whatever. He would have been at somewhere
Yeah,
like City. He would have been somewhere like Arsenal, Chelsea, Tottenham. But no, he was in Celtic. And this is the thing. Yes, he's good now, but I mean, who's the next best defender? Probably Harry Maguire, and we know he makes mistakes.
yeah.
Or the guy from City, Laporte. He's probably the best defender in the
I
league.
really like
I
Laporte.
think he's the
Yeah,
best.
I really like Laporte.
But these guys are, they would be fifth choice in a good team from 10 years ago. And I say this to people, and they go, "No, no, he's been the
Yeah,
best defender in the world." I was like, "No, Sergio Ramos has been the best defender in the world." And if
yeah,
if you actually watched the four Champions League wins that they had, Ramos was essentially playing left back and centre back, because where was Marcelo? He was playing centre forward half the time. So he
yeah,
was playing two positions, and that's why sometimes you see him diving into tackles and getting sent off, because he's playing two positions. That is the best defender in the world in the last 10, 20 years, I think.
yeah,
Maybe
yeah. He comes.
some
Yeah,
beyond.
yeah. He comes in. He, he comes in with those important goals as well.
Yeah.
Like he scored in finals, and he gets you that penalty as well. Like he's good at penalties,
Mm,
and then he scores those important goals, like the goals which edge you, which gives you an edge
mm,
in the game. So yeah, he has everything. He has the leadership qualities, the heading ability, the penalties, the long ball distribution. He has everything.
yeah.
Van Dijk, on the other hand, he is a colossus. I
He's
really like his
he's a good
defending.
defender, but from my point of
Yeah,
view, still, if he's the best defender in the league's very poor. This is my
yeah. In
personal,
terms of
yeah,
defense, yeah,
because I see holes in his game. He doesn't make a tackle, he backs off, because he go one on one with Van
yeah,
Dijk, you beat him every time, which is why you never see
yeah,
him commit to a tackle. He always backs off and
yeah,
waits for Fernandinho. What's his name? The Fabinho waits for that guy to come
yeah,
and make the foul or make the tackle, or he makes the tackle when there's two other guys here, which is clever,
yeah.
but he's not the be all and end all, and he'd make a big difference for sure. But I think if somebody puts together a system, then you'll easily overtake Liverpool. I mean, Man City is the team to beat, by far and away,
Yeah,
by far and away.
for sure. Because but what I heard was that Aguero is out for like another 2 months, and then Jesus is also out. I read it
Mm,
today that he got an injury and he's out for probably 3 weeks now. So again, the attack is like pretty exploited now for Chelsea, for Man City. So I don't know what will happen. De Bruyne again has a lot of responsibility on him,
mm,
and I don't know who'll start for at the striking position for City
I think
now,
it'd be
because
Sterling. Yeah,
Probably Sterling might go in, and
Mahrez.
Be on wing. Mahrez would be on one wing and De Bruyne on the
Oh,
other. So I don't know.
Bernardo
Again,
Silva's
yeah,
still there.
no, but yeah, but also there, and yeah, you talked about defenders, so we were linked with what's his name, that Leipzig guy,
Upamecano.
Upamecano. I don't know.
Yeah.
Yeah, and then Diego Carlos as well from Sevilla. He's pretty good as well. But yeah, they're not that quality, that Ferdinand, Vidic, Terry, Carvalho quality defender,
Oh,
Sol
even
Campbell,
Sol
Tony.
Campbell. Who else was there? There was
Yeah,
they had what's the other guy who played for Ledley King. He was a You couldn't beat that guy in the air or on the floor. And I think part of the
yeah,
problem, right? You now have strikers who, just imagine Alan Shearer, right? I don't know if you remember this far back. He
yeah,
would
yeah, I do, man.
he was skillful, good touch and this sort of thing, lethal first one touch finishes, and he would beat up the defenders. He would physically tire the defender out. There's no striker out there anymore that does that.
Yeah, you're right. You're absolutely right, because he had everything. He had headers, he had that left
Mm.
foot shot, he had free kicks, he had 260 goals, man, in the Premier League. Like it's been long
But not even the
since he
goals, just
retired.
that kind of a guy who's physically gonna challenge
Yeah,
the striker, because I mean, there used to be like a guy who, he might not score a lot of goals, but you go one on one with the guy physically, he'd be stronger than Ferdinand, he'd be stronger than Vidic. or or
Yeah,
even from like Bolton, there'd be players who are physically stronger than the centre half.
Davies.
Yeah,
Yeah, Davies,
you
and
don't have that
then
anymore.
you
They're
had
all 5'8".
yeah. In that sort of perspective, I really like Raul Jimenez from Wolves.
Which is why he's doing so well.
He's
Mm,
Yeah, he's a very good striker, and then he holds the ball. He holds the ball. Then he had Jota, but Liverpool, got him now.
mm.
Podence is not that bad, but obviously he's not the same level as Jota. But then he has Traore. But again, Jimenez is like I believe that he should be at a better club. I know Wolves is doing amazingly
They
well,
want 90
and
million for him, though, so it's not happening.
yeah, yeah, but still, he's a really good striker.
Mm,
Like there are utility players, and he's one of that utility. If you want him to defend, he'll defend. And again, he's very good at striking. He's like that striker which in the Premier League right now, which you think of like, all right, who's that striker which you want? Like he's in the top three for me for
mm.
sure.
Yeah,
Doing something,
he's someone who can make a difference, and he's physical in a way
yeah,
that no one else is, and that's why he's so effective. Because defenders don't know what to
yeah.
do with someone who's physical nowadays.
Because if you take the example of Harry Kane is someone who I believe is the best striker when it comes to in the box. Like 9 times out of 10, I
In the
think
Premier
his
League, yeah.
shots on target. Yeah, in the Premier League, 9 times out of 10, he can score goals from inside the box. He has a good shoot, left, right, both. He doesn't have that holding ability
No,
for
he's not.
me, like
He's
the
big,
Giroud.
but he's not physical. Yeah.
Yeah, like your Girouds or your Jimenez's, and so that's the quality which he lacks. But again, their system is again when you see the system of Mourinho, you've seen it all over. Like he used to have this one striker, like Drogba used to be there. He used to hold the defenders off, and then Lampard used to go in,
Mm,
and Balak or Lampard or whatever, Joe Cole, they used to go inside. So Mourinho plays with that thing. But now at Tottenham, he's doing a different thing altogether.
mm.
Son for him is like the marquee player, the star player.
Just wait
I'm
till
watching
Bale
his
comes in.
documentary.
I'm worried.
Yeah, yeah. I even before he was coming here, I was watching his goals, like those scorches which he scored against Sunderland, West Ham, and Stoke, and then like the quality which that guy has. I'm genuinely happy for Gareth Bale,
Mm.
like genuinely happy
I just wish he'd gone
because he
somewhere
was.
else.
Yeah, I wish he had come to United because again he's the proper winger which we needed. But
Even for a
again,
year, yeah. If we don't get Sancho, but yeah, that's
yeah,
the thing.
yeah, I don't know, man. Sancho saga is like going till the wire. I don't know what will happen. I have a feeling that we might sign him. I don't know, like might,
I think
big
we have to
might.
sell to sign. Yeah.
Yeah, we're not even selling players. We're just loaning them off. I don't know what we're doing with Jones, with Rojo. They don't want to play for us anymore.
Yeah, I don't know. We'll have to see, and we'll have to see.
Yeah. So let's see what happens tomorrow. I hope we win, but I'm not sure. I'm not really sure because Brighton at home is tough to beat, man.
Mm, yeah, we'll have to see. Anyway, we'll stop the recording there, man. It's been great to have you on. The guys who've been
Yeah,
watching, I hope you enjoyed it. We definitely have, which is why we've managed to go at 2 hours 15. Crazy, crazy. Longest one we've done so far.
I had a fun time, man. Thank you for inviting me, and we talked about everything.
Yeah, I think
It's
we did.
in Pakistan it's 4 a.m. So yeah.
Yeah, thank you for guys. Thank you for everyone who's watching. Make sure you're liking the video, subscribing if you're new, leave comments down below on any of the 210 topics we talked about today. Um, and if you're enjoying the work that I've been doing on Instagram, on YouTube, and all these other things, then head over to the Patreon group where you can help support the channel. It helps me get things like a nice microphone so I don't sound like I'm shouting from the other end of a football field or something, and very muffled. So hopefully you guys can tell the difference and can see the quality of the stream and stuff like that. So if you want to help out with this kind of thing and let me do it full time, check that out, guys, and that'll be great to have you on there. But Saad, been amazing. Thank you for coming on, man.
Thank you so much for the opportunity, and yeah, again, Dr. Zubair is doing an amazing job with Dentist of Insta, and you guys do follow him. I've been following him for a while, and I always wanted to come on the show, and I had the opportunity now. So yeah, I think we both really like to talk because we've been going on for 2 hours and 15 minutes now. It's 4 a.m. over here in Pakistan. So yeah, you see the dedication.
Yeah. Awesome,
So
guys.
yeah,
See you
great stuff,
later.
man.